Collaboration and Leadership Video. Assessment 1-1. Stacy Tyler, Capella University. Class of Leading People, Processes, and Organizations in Interprofessional Practice. Interdisciplinary collaboration. On a med-surg unit a few years ago, we had a patient fall out of bed who was confused, and at the time we were understaffed and not able to appropriate any additional staff members to sit at the bedside of the patient who we wanted to make sure they could safely stay in bed. It was inappropriate to utilize restraints as the patient was not combative nor a danger to themselves or others. The patient had been at the facility for 3 days, and there were continuous complaints by the staff asking upper management for a staff member to sit by the bedside of the patient who consistently displayed signs of confusions. As a resolution, the staff was encouraged by management to keep an additional watch on the patient. On the third night, in the evening hours, the patient was checked on by a staff member and was found to be on the floor. The medical team then followed protocol to take care of the patient. The lack of listening to the staff members about a potential undesired outcome caused the unfortunate circumstance of the patient falling to the floor. Their communication strategy was unsuccessful. Valuable insights can be achieved by combining nurses' clinical expertise and knowledge of individual patients with the integration of the clinical staff into medical management, as stated by Liu in 2016. On the morning after the fall incident, there was an interprofessional collaboration meeting. Present, there was a physician, 2 nurses, a nursing aide, and a chief nursing officer, also known as the CNO. The CNO brought up the situation and asked the staff members what they believed the issue to be. A key attribute to a leader is learning how to examine our inner strengths and weaknesses, stated by Robinson in 2020. The conversation between the staff members was solution seeking. They discussed what they were doing right for the patient, and they also identified areas for improvement along with a positive conclusion to the fall. As a result of the reflection of the issue, the team came to an outcome that was favorable for the patient. During the patient's stay, there were no more falls and the dilemma was resolved. The deliberation was successful in solving the issue for the patient and staff. As a result, the team learned that by coming together and reviewing the positives and negatives, they could alleviate the problem and also utilize the same strategy for future mishaps. Results of poor collaboration. It was evident that the implementation process of the electronic health record system at Clarion Court Skilled Nursing Facility was not a smooth transition for any of the staff members. Everyone was disgruntled about how the operation took place. It seemed that almost everyone was aware of the necessity of a new system. However, most felt that they were not equipped appropriately to operate the system before it came or once it had arrived. The poor collaboration between staff members began with the administrator, Stephen, who was not on board with the program. This was evident because Stephen had said many negative things about the program and even voiced his unhappiness about Josh, the coordinator of the new program, and he was the one who explained to everyone how it worked. Next, the nursing staff didn't seem to work together during these issues. Shonda and Nora struggled with the program, and both were disgruntled because they believed that Lisa was well versed in the new operating system, yet she wouldn't take the time out to teach them. They were angry with management for the sudden changes. The IT manager, Chad, did not appear as cooperative and supportive as he could have been, nor was he trained to operate the program effectively. As a result of all the combination of many calamities, the team members did not collaborate with each other appropriately. Human and financial resources were exhausted inappropriately and could have been managed better. In a study by McInnes in 2015 about medical teamwork, it was stated that hierarchy, education, and liability were found to be major factors in poor collaboration. Each of those factors were present during this transition period of the new system. Best practice leadership strategies. The issues that happened at Clarion Court Skilled Nursing Facility involving their new electronic health record system could have been prevented had the staff collaborated better initially. The administrator, Stephen, should have understood the need for the new system and asked for some sort of training before the implementation process for himself and the staff. In a study about the nursing workplace injustices by Skinner in 2017, the results stated that the participants emphasized their lack of voice and were frustrated that management did not listen to their ideas and concerns, which in turn affected their attitude and work habits. They showed that by doing the opposite and listening to their employees' input, it improved the work environment. As a best practice leadership strategy, Stephen could have used a similar study to enhance the interdisciplinary communication between the team members. Many of the employees at the facility voiced that they were upset with the lack of training and resources available, and as a leader, Stephen could have listened to them and sought out a solution. Lisa, the nurse, should have been encouraged by Stephen to be a resource for the nursing staff because of her shining ability to understand the program. This could have encouraged the other nurses to learn in a positive manner and improve their disappointment in her, since she would now be helping them. In the future, it may be beneficial to utilize current staff members as resources because none of the staff was comfortable with Josh, the man who was from somewhere else, trying to tell everyone what to do. They may be more receptive to the people that they are used to. Best practice interdisciplinary collaboration strategies. A 2019 study by Baird about interdisciplinary communication in the healthcare setting said that practitioners reported improved communication and collaboration with staff when there were structured interdisciplinary meetings involved. Although there was no meeting that took place at Clarion Court with the different disciplines before the utilization of the new system, the facility can use the negative outcome as an example of what not to do. Moving forward, it may be wise for Stephen to include all staff members when there is a new implementation that will affect everyone. The 2019 Baird study also showed that involving everyone, the staff gains more respect for upper management and they are much more cooperative and willing to accept the new changes. Rhonda, Lisa, Nora, all being part of the clinical team, would have appreciated being involved, and they may not have been so upset if they were. Elise, the director of operations, could have used better interdisciplinary collaboration by bringing together Josh, Stephen, and Chad to discuss the IT issues at hand. In conclusion, although the implementation of the new system at Clarion Court seemed to be what people make out as a disaster, the entire staff can utilize this as a learning experience. In the future, in accordance with best practice studies, the nurses can go to Stephen to voice their concerns, and Stephen can respond by listening intently and addressing their issues in coordination with Elise. The IT department can also, in the forthcoming, inform Stephen when they feel inferior and ask for more autonomy and training so that they can take care of the issues related to their department. Stephen can bring the entire team together so that they can give pros and cons of situations that involve everyone, and as a result, the entire team can benefit from a better work environment.